having me. Pleasure to be here. So when I first read the question of what was presented to us about how can we, through education, best shape and sustain a society that is plural, cosmopolitan, prosperous, and then the biggest things for me were inclusive, responsible, and cohesive. So I think that's where I really felt like healthcare would jump into this, being inclusive and cohesive. And then, of course, it's just being responsible. So to start this, I went into the background of where nursing began. That's my training, that's my trade. So it was like going back into the 1860s, Crimean War. Florence Nightingale was a scientist. In the war, the soldiers were not dying because of wounds, and they were not dying because of gun wounds. They were dying because of infection after they were wounded. And so she went in and was like, what's going on? And realized that basic things were not happening. So this, to me, was a time of much uncertainty, much of what can we do. And she went in and basically said, wash your hands, open some windows, ventilate, basic things. And survival rates went up drastically. And they're the invention of nursing, the creation, whatever word you like to use. So to me, that was like, okay, that was an uncertain time. There was a whole new discipline. People's lives were saved. Okay, so how can I like put that kind of drive into education where it's uncertain, where these underserved environments. And to get more motivation from this or more kind of ideas, I went and asked some of my colleagues from both Brigham and at Mass General, just asked them one general question. And the question I asked was, okay, so you are being consulted as an experienced healthcare provider. And there is an elementary and a high school being built in rural Kyrgyzstan. And I said, from your perspective, what are the most important healthcare aspects to consider when developing the blueprint for the school? So what do they want to consider? What do you think they should consider? And these were people that were just plain old. One person was a psychiatrist. I had a couple of infectious disease doctors, a few nurses, and just one surgeon, a couple pulmonologists. Nothing, just general people I met. And so overall, the responses were very similar in nature, and I'll go over what they were. So everyone said clean water. I think that was the first one. Vaccines, nutrition, safety, hygiene at school and at home, home life considerations, and then one that I thought was pretty remarkable that I didn't realize was depression screening. And so I'll go into each more of those in detail. And so I think when I asked him more about clean water, it was potable water, drinking water. How do they get the water? Is it running water? Do they have to go and actually physically bring it up? But the whole point was clean water. And so the basic for me was you can't tackle the bigger stuff until you get the basic needs. So we have to make sure that's kind of standard. Okay. And that was kind of a simple, hard, but simple concept. Vaccines. And so, I know there's a lot more controversy, especially in the United States, happening regarding vaccines. But in my opinion, the bottom line is vaccines work. Vaccines work. If we look at the eradication of polio, it's gone. So I think that's where education on vaccines, and then getting infectious disease experts to come in, they said, or just people that are familiar with the area and saying what vaccines are most important to the area that the children and families are being educated in. And then I know that from someone that needs to get patients vaccinated, taking out hurdles to get people, students and families, the vaccines. So rather than saying, okay, here's a list, go get them, it's saying, come to the clinic at school. Like this would be an example, and we'll give you the vaccines you need. So take out any hurdle to the vaccines, and that way you get herd immunity, everyone's taken care of. So it's kind of the quick and simple of that. Then there was nutrition, which goes beyond just food. So you can say that everyone's fed, but how are they fed? Is it nutritious? Are there vitamins and minerals? Is it aligning with the growth and development that the adolescents, prepubescent, and preteens, teenagers are needing to supply their growth and overall development? And I think that goes along the lines of what Stephanie was saying downstairs with that very crucial time of growth and development. So it's making sure those needs have been met and how to meet those needs. And then there was safety. And this was a very broad topic to answer because there's so many aspects of safety to take into consideration. I think in the United States we have gun safety at school right now, which is a huge issue. But then there's also those issues when we go across the world. And so is that the only safety issue, or is there also safety in the classroom, just feeling like you can learn without being made fun of if you have an answer wrong? So where does the safety take place? So I think looking at what safety really means in schools in a lot of different aspects. And then there was hygiene at school and at home, which I think also tied into the home life considerations. So hygiene, I think it's also being reflected into, is there clean water? Hygiene also being reflected into vaccinations. And then there's physical hygiene, mental hygiene, which also I think the mental hygiene connects into home life considerations being, again, of what Stephanie was saying about do they go home and do they have to cook? Do they have to clean for their family? Do they have to take care of children? What is their support structure like at home? Do they have a support structure at home? Is it one parent, two parents? You know, examining those type of, that intersection between the family, the school, and the social group. And then the last one, depression, which I thought was very interesting. My psychiatrist friend brought it up, not shocking. He said it's very hidden, and it's one of the top diagnoses among all Americans, and it's very easy to not diagnose. And not saying that we want to quickly just label anything, but it's so that we can address something actively. And he said, and not through medication, and I thought that was very important. He's like, it's not so we just get them on a medication and fix everything. It's so that we give them the resources and support of mental health providers, social workers, even teachers just having a little bit of added training on how to treat depression. Because in children especially, depression comes through, not through being able to, okay, I'm feeling this emotion, I'm going to speak about it like this so someone can understand it. It can come through as much more of an anxiety, acting out in school, missing school, and it can be assumed as a very negative behavior when we're actually really missing a big piece, because I think depression is such a big umbrella scale of what it is. And so I again say that it's very important to not just say, okay, medication, it's to really treat the symptoms of that person. It could be something small related to home life, or it could be something much bigger. But I thought looking into that and how much it's actually potentially missed or